Hello, guys. Good afternoon. What a week, wasn't it? How much learning. The Nova Klabin Festival at home. Thanks you for your participation. We had over 100 lecturers and speakers who shared their experience with around 20,000 guests. And you have followed us in this journey of lectures, workshops, and exchange of knowledge. You know what I'm talking about. It was incredible, right? I loved it. So much innovation, so many people paying attention to everything that's happening around us and looking towards the future that we want, the future that we desire, the future that we are already building. But if you are just arriving now or you missed some content that you wanted to watch, feel at ease because the Nova Clubbing in Casa Festival will only be closed in 30 days. Up until then, the presentations for the past 5 days are going to be available for you to watch for the first time or to watch it again and to have the experience of listening to leaders of major companies and scientists talking about innovation with a purpose. And to close our festival, we are going to listen from two wonderful personalities who have as their life purpose to contribute to a better world. Viviane Mosé and Dr. Drauzio Varella. What wonderful guests, isn't it? So during the presentations, you can ask questions, and at the end of the presentations, our guests are going to be answering them, okay? And we are going to start with poet, philosopher, psychologist, psychoanalyst, and a specialist in the drafting and implementation of public policies, Viviane Mosé. What a pleasure it is to have you here with us at our festival. How are you doing? It's a pleasure to be here with you at Nova Calabrin, and I hope I can contribute. I am sure that it will be a great contribution. Last time I interviewed you was at CBN Radio, and you had people thinking a lot. It was around Christmas time, and I was very emotional. Vivi, you are known for thinking about civilization, and we are undergoing a civilization crisis. What can you tell us about that? Well, I'm going to be telling you for 15 minutes about the scenario that we are going through when we have serious world crisis as we are seeing now. There is a tendency of us enclosing ourselves into a certain interpretation, not being able to look far beyond, and we need to look at it from the outside. So I can just go ahead, right? Yes, Vivi, the floor is yours, and we'll talk soon. Okay. So first thing that we must have clarity about, that we must be clear about, is that we are undergoing a serious crisis, but it's not the coronavirus crisis. We are undergoing a civilization crisis that dates back before the pandemic. So I'm going to talk to you about the scenario before the pandemic and how the pandemic plays into all of this. So let's understand what we were living through before the pandemic. We had and we still have a serious environmental crisis, environmental exhaustion, and we know what that exhaustion has been about. In the past 15 years, it has been the subject of matters at school, researchers, newspapers, conversations, and this environmental crisis generates all sorts of issues. We imagine that the main problems of the environmental crisis would be tsunamis and earthquakes. But what we have now is this pandemic. We eliminated forests and animals, and this environmental crisis ended up fostering this virus. We have no question that if we don't change our relationship to the planet, we are going to be host to new types of virus. This virus that we are battling now, we are still not on the winning side of this process. This battle with and these processes have happened ever since we started the planet. But we don't only have an environmental crisis, we also have an economic crisis. We have the inequality in the world. We have people who um, hoard billions and billions of dollars, and this financial hoarding ends up not having true value. Like if you have $20 billion and you make another billion, that's not really going to change your life. But $1 billion, if it was invested in a favela in Rio de Janeiro, would make a world of difference. So this inequality is quite cruel. Part of the resources of the planet are in the hands of very few, and that creates violence, that breeds violence and social crisis and economic crisis, the social crisis, the occupation of cities, large cities, the way that we deal with one another. This is all very serious. And we have an additional crisis, which is human exhaustion. Suicide is the second reason for death amongst young people in the world for several decades. Recently, the suicide of children and adolescents in Brazil that has grown 40% in the past 10 years. So currently, we have a society that is dedicated uh, to self-medication with psychiatric drugs. So we have a population that is depressed, that uses a lot of psychiatric drugs with a high level of self-mutilation and suicide. So human crisis is perhaps the most serious pandemic of all, because in order for us to deal with the environmental crisis, with the economic crisis, we need people who are up to it, young people who are courageous and determined and committed to change this process. But what we have is the reverse. We have people who are in a crisis, who are at odds with their values, and all of that is happening through a technological revolution that gave us many changes. The world was vertical, hierarchically speaking. We had the owner, the king, the president, the CEO. 20 or 30 years ago, that had a value that now it doesn't. We are at a crisis. Management systems now have to deal with this new horizontal way of being a company to innovate. We need to have young, bold people. So boldness is part of this management model. And all of that has torn our society. And we are living through all of that. When the pandemic started, it brought us the Third World War. The Third World War is the information war that happened before the pandemic, that happened with the dropping of the vertical models. You had universities such as youth that was like the authority. We had like books and authors, and we had journalists that told us what was what and how we should behave. So we know that everything suffers a certain level of manipulation. But it was at least a reference for us to be able to criticize the press, science. But now, when someone creates a beautiful video, a beautiful image, that's what they know about. So that created a chaos when the pandemics arrived. That was just a contributor. We were already doing badly. The pandemic gave us a chance or a possibility. It's almost as if nature put us on a crossroads and said, stop everything. You either resolve this or you're dead. And we can't deny that the pandemic has been good, even for the negationists. I know that's a great suffering for all of us to think about the pandemics, but we are all being crisscrossed by this suspension of civilization. We started to live and think and act through new models of family, of being a human being, of having a relationship with nature, new work models. This all has become an imposition now, not a choice. The main danger brought by the pandemic, and I gave a lot of interviews about that, and everybody knows that at the beginning there was a hard economic crisis, how to keep the machine going if everybody was locked down. And I'm not even talking about capitalism here. We are beyond that. We have the civilization machine that goes from the simple gestures to all the models that we use for management, education, communication, health, everything. All of that is a big machine with values. And the civilization was put in suspense, was brought to a halt by the pandemic. And I say that we now have a building that's in shambles and one that's being built. Depending on how you look at it, you are going to see a building that's in shambles or another one that is being brought up. We have no perspective of the future. So when we look at civilization and we feed from the information that comes and the political crisis that this is starting and triggering here in Brazil, but also in the United States and other places in the world, we only see negative processes. We only see the building and ruins, over 500,000 deaths, and we have no idea of when that's going to end. We could have new viruses, new strains of the same virus. It seems so unreal, but it is real. We are facing an unbearable crisis, a humanitarian crisis, the crisis of the occupation of the earth. So necessarily, we'll have to leave here with new models for action, for relationships, for living together. There is no solution. So if we are talking about innovation, you have to think that it's not enough to look at the scenario and act upon the scenario. We need to understand that we have new human relationships already happening. Parents were not taking care of their own children. I'm a mother, I know that. Would that closeness with the children create more conflict, decrease family depression? Perhaps in such a hard time, this idea of a link, of a tie, of a rapport, makes us rethink the concept of family. That was an amalgamation of people that gathered under a roof. So I could speak for hours, but I'm going to tell you the following. We are before a serious crisis that puts the possibility of the extinction of humankind in the earth and makes it very clear for us. But we know a lot about technology, and technology has saved us, because if it wasn't the virtual world, the machine would have stopped. It didn't stop because it became virtual. This network society has saved us, but it has fake news that could destroy us. So the good and evil are closer than ever. What is going to save this century is not technology, it's human relations, affection, and rediscovery of the value of life. The civilization is at a crisis, but we all have the right to live, to be born, to procreate, to live. Our life is happening now, and we should live it in all its grandeur. We should not depend on civilization to live. We must be alive and mark our time in this planet, our passage in this planet, by bringing life, begetting life, fostering life. That's what I wanted to say to open our debates. Because innovation is not only about technology, it's also about people, as you've mentioned. Thank you for your explanation. I ask you to keep connected with us. In a bit, I want Vivi to be back to interact with our next guest. I'll see you soon. So now we are going to talk to him, the oncologist, the Brazilian oncologist, author, and presenter, Dr. Drauzio Varella. Hello, Rosana. Very good to hear from Viviane, isn't it? I think she characterizes very well. Yeah, she gave us this very interesting perspective that the pandemic is an opportunity for all of us to reinvent ourselves. And it has never been as urgent as necessary for us to believe in science, to take this leap in quality of life, right? Yes, we have been living a very complicated situation, as very well put by Viviane, particularly in a country like Brazil with such a severe inequality, which we have become used to, unfortunately. Brazil is a country with inequalities. It's more unequal than Qatar. Brazilian society is just like that. Well, let's recall that up until 1988, 1888, we had slavery here in Brazil. And in Egypt, they already had slaves. In Greece, they had slaves. In Rome, they had slaves. All throughout Europe, there were slaves in the Middle Ages. And here, the slavery lasted almost to the 20th century. And people were used to that. You know, they said that you couldn't do away with slavery because the economy would break. But it came a point where society said, no, we no longer want to live like that. We must end all slavery. And slavery was ended. That's exactly what we need to have happen to social inequality in Brazil. We have gotten used to it and we believe that it cannot be changed, but of course it can. It's not going to be easy, as it wasn't easy to finish slavery, but we have to face this problem head on. What we are seeing now with the pandemic is the high price that we are paying for being a country that is so unequal with such a low educational level. A major part of the population that attends bad schools, poor quality schools, that don't have access to internet technology. What we see now is dramatic, what we are going through here. But I believe that in the midst of all this tragedy, we have a path that somehow we were able to thread. Let's remember how that all started. Well, the epidemic started in China, and we didn't know it was an epidemic. And it's not just me. Center for Disease Control, the CDC in the United States, had no idea it would become an epidemic. The World Health Organization didn't believe that this virus had the potential to cause a world pandemic. We started understanding what the pandemics was going to be like in February when it arrived in Italy. When the virus arrived in Italy, the information that came from China was very precarious. But then when it came to Italy, that had free circulating news, we understood what was happening. The day that the Italian government closed the cities in northern Italy, on that day, the Spanish government authorized democratic demonstration on International Women's Day that gathered 200,000 people in the main cities of Madrid. How could they allow that? You know, they are right next to Italy. Well, we were not understanding what was happening. We didn't have enough information. The same happened in Brazil. And so what could we do about that? Well, we needed to take practical situations, convenience. We had a virus that would spread through speaking, coughing, sneezing. We needed to bring people apart. We can't forget that, for example, there was no proof that masks would protect us. When it arrived to New York, the virus arrived in New York, the financial capital of the world. In New York, there were no masks in hospitals. It's not that you couldn't find it in drugstores. They weren't available in hospitals because 98% of masks were manufactured in China. Nobody was manufacturing that because nobody could compete with Chinese prices. And, when the virus spread there, they stopped exporting. So, the hospitals in New York didn't have masks for its employees or patients. So we were caught red-handed in something that we had no experience with. And it was disseminated. The countries that didn't respect basic care suffered more, which was the case of Brazil. But all countries suffered the spread of the virus. And then we had two major factors that acted concomitantly. And I hope that serves as a lesson for the Brazilian people so that when the next epidemics happen, and, there will be a next epidemic, we just don't know when. We have to understand that there were two pillars in the fighting of this pandemic. The first one was the universal healthcare service, the SUS, the universal health system. The SUS image for Brazilian people is no longer what we were used to see on television, hospitals packed to the brim with people complaining. People are always thinking that SUS is just, a mess, like it's shown on TV, but actually no country with over 100,000 people there to provide free healthcare for all. We must be proud of our healthcare system. Our healthcare system is fantastic. It's not complete. It's not as organized as it should be. It's full of defects. But, in face of an epidemic like that, if we didn't have this universal health system, what would be happening? People would be dropping like flies inside their homes on the sidewalk. But somehow we were able to structure this healthcare system by innovation. Not that we were prepared for the situation, but we put together ICU beds and we rearranged the healthcare in the country. In some states, in some cities, it was more organized than others, but we saw the work of this universal healthcare system throughout the country. And that's no simple task. And it's still no simple task because we are still in the middle of the pandemic. That was one of the pillars. The other pillar was what? Science. You can't deny science. You can't negate science. Science points to the future of humanity. It has right things, it has wrong things, but innovation is what tells us what the world is going to be like. How do we have to empower ourselves to take care of the future? Nobody ever thought that we would be able to create a vaccine in less than a year, and highly effective vaccines like that. And people are like, oh, I'm so afraid of these vaccines. It was all too hurried. Well, we were praying about having vaccines. It gives me this impression that when the epidemic started, they went to the lab and said, well, let's create a vaccine here. No, that's not like that. The technology for the manufacturing of all of this vaccine has been studied for decades, for many, many years. And this record time vaccine was based on all the research that was made beforehand, and therefore we could produce and manufacture efficient vaccines, not in the quantity that we would have desired. We have like 7 billion people in the world. It's almost impossible to manufacture as many vaccines, and the deadline that we have a year and a half. But we changed in terms of level, even in a country with a great delay in vaccination. There are some people already being vaccinated, and there has been a reduction in terms of mortality for those who have had the 2 doses of the vaccine. So how do we need to organize the situation here in Brazil, individually speaking? First of all, we must think that we are going through a very dangerous moment, very dangerous scenario. We cannot put ourselves at risk and our families at risk. You see the measures that have been adopted at Klabin, masks, avoiding social crowding, the washing the hands. Some people get upset about it because they don't want to have that care, but that has to become part of our culture. We need to learn that. For those who work in civil works, would you ever go there without a helmet? You wouldn't. The helmet is necessary. It protects you. And we are going to have to develop this culture that, yes, we are going to have to wear masks. We're going to have to avoid overcrowding until the epidemics ends. I believe that we are going to need to use masks in many situations in the future. When you have like the flu, the Japanese, for example, have worn masks for many years. People here laughed at them. Were they wrong? No. So now we need to adapt. We must adapt to this new situation, this new reality in Brazil. The epidemics in Brazil is completely out of control. We have had a huge number of people infected, and we have around 2,000 deaths per day, which is an unacceptable figure. And that's not only a problem for the country, for the authorities, for the government. It is our problem. As long as the virus is circulating like that, it's dangerous for us. We could get infected. Our families could get infected. The community is at risk. So it's not enough for you to be careful at certain times during the day at work, because at work you're not going to be without a mask because it's forbidden. But as soon as I leave the company, I take my mask off and I go to the bar. I go to, parties that shouldn't be happening, or I go to a restaurant. The control of this virus, the spread of this virus depends on our behavior. Oh, but I have already been vaccinated. Well, none of the vaccines, AstraZeneca, Oxford, Johnson, none of them, Pfizer, will protect you 100% against the infection, which means, well, if I get vaccinated, I probably won't die of this disease because they all have a protection against the serious form of the disease. So I'm probably not going to die, which is already a great thing. But you also don't want to be infected with this disease because what's your risk? The risk is that you might have, a light form of this disease, have like 2 miserable weeks, and then you will improve. Perhaps the vaccination will allow you or afford you this degree of protection, avoiding that you get a serious case of the disease. But we now know more and more that these symptoms could persist for longer than 15 days. That's called long-term COVID. And that is the case of 20 to 30% of the people who had this light kind of disease. And what does it causes? Well, I published an article in the Brazilian newspaper Folha de São Paulo talking about the complications, joint pain, muscle pain, tiredness, wheeziness, loss of smell, loss of taste. That could go on for months and months. You probably heard about someone who has had COVID. If after 2 weeks they were, ready to go, you're going to hear how many of them have had problems. Some people have had COVID 6 months ago and they are still not back to normal yet. They still feel tired. They are still unable to do their tasks as they did. And one of the most common complaints is, this foggy brain, difficulty remembering things, or difficulty doing things at work that they did with so much ease before. So it's a very complex situation right now. So what do we need to do? Well, if it has come your turn to get vaccinated, go get vaccinated. Don't wait for any particular brand vaccine. While you're waiting the vaccine to arrive, you might die eventually. So you have to do what you need to do. On my day, I went there, and when she was, giving me the vaccine, I asked her, "What am I taking?" And then she told me what brand it was. I want to take any vaccine. I don't want any severe complications of this disease, which could happen often. So don't forget to take your second dose. That is really important. Don't you think it would be interesting for the laboratories, for the pharma companies to sell a vaccine that was only a single dose? With a single dose, you don't have the level of protection that is necessary. So you need to have the second dose to be fully immunized. So please do that and advise your family members to do the same. And right now, just wear a mask. If you're leaving your home, wear a mask. Don't go visiting your friends. This is not yet the time to do that. We have vaccines now. The number of cases will dwindle, and then we'll get together, we'll make our barbecues, we'll have our parties and celebrate. This is not going to last forever. Dr. Drauzio, thank you so much for your very important words, for your alert. Even with vaccinations, we can't leave protocols and sanitary protocols aside. I want you to please keep on here with us. We're going to bring back Viviane Mose to answer some questions from our audience. The first question is addressed to Viviane Mose. Vivi, how can companies make a positive difference in this new world that we are living in? Companies can and should make a difference, particularly in the corporate world. That's one of the most structured things that we have, the corporate world. So the possibility of a corporation such as this, of having people be directed, influenced, there's a huge possibility. So we must change the relationship with the world, with ourselves, and with each other, and the management models. But how can we go about that? We've learned with the pandemic that we can, for example, replace someone being present at the company for working from home. We learned that we don't need as many meetings. A mother with a small baby, if she lives far away, you know, perhaps she doesn't need to work presentially. We could have people working from home forever. So we need to change certain models. We need to think and sophisticate the virtual world, diminishing the number of people that come to the office, the number of people that come to the office. We need to use the possibilities for homeschooling and for virtual schooling. So this virtual world is helping us with everything, but we also need to change the way that we deal with nature. We have technology nowadays that allows us to recover the rivers and the oceans, and we have technology, for example, to change public administration. So think with me. Let's think of a humanized management system where we could have less representatives and congressmen, and we could have more people who would be working from home and working um, on public policy. We have the technology to change every process that we need. Technology saved us. We could be hitting each other on the head with a piece of wood, but we didn't have that situation because we had, the machine run virtually. So we need to use technology to change everything. But the last thing that I cannot forget is that we must understand that we have life, and life is not being lived in the civilization bubble. This bubble is bursting. So you have to recover your relationship with yourself, with your body, with your family, with nature, and with the people around you, not the people on the bubble. You have to fight to have control, but that could be a mistake. The civilization is falling down. 500,000 people are dying because of this way that we have had for civilization. So we need to recover the sense in life. That's what's going to save us. Now, a question for Dr. Drauzio. In your point of view, Dr. Drauzio, what are the main learnings that we have from this pandemic so that we can be better prepared for new epidemics that could be coming our way? I think the first learning that we have is that when the next epidemics comes around, I probably will no longer be here, but you will be. And when that happens, don't use the word risk group. Uh, Forbid this expression to be used because this category of people have shown that it's only good to disseminate the epidemic faster. When AIDS started, they called the risk group homosexual males, but actually all the women believed that they didn't belong to the risk group. Now, men that are not homosexuals were also belonging to that group. The drug users of injectable drugs didn't believe they belonged to the risk group. So, the disease spread a lot more than we expected. Almost all users of injectable drugs got contaminated. Now, the same thing. They said that the risk groups for COVID-19 were people over 60 years old, the obese with high blood pressure. Well, half of the people in the ICU today in Brazil are younger than 50 years old. The number of young people with very severe COVID-19 with prolonged stays at the ICU is a huge number. It's a huge number of people. Out of these 500,000 people who died, a very significant portion were of young people with no comorbidities. So that's the first thing. The second thing is we must value science from the first minute on. Science must provide the answers, but they are not going to resolve anything. The people who are going to have to take on the responsibility of fighting the epidemics are the politicians, the leaders. They are the ones that should be addressing the issues based on science. I'm going to give you the example of HIV, which I followed on very closely. What did we do? The Ministry of Health, when the first drugs that were efficient against AIDS came around, They said, we are going to treat every Brazilian. We thought that would be impossible because, the drugs were really, really expensive. But Brazil went there, they fought, they broke the patents, and we found a way to treat everyone. The impact was unbelievable. Brazil was a world leader in the fighting of HIV/AIDS. And now we are seeing the exact opposite due to this denial of science. We must understand that politicians are the ones that define the rules. They have to put together the strategy for fighting something, but they have to do based on the opinions of scientists. They must learn what are the best methods. They must learn what they need to privilege. What is the role of the public sector, the private sector? But there is a question about the role of individuals, of each citizen. As individuals, what can we do to reverse this crisis in our society, Vivi? Well, you need to be bold. You need to do different because we talk a lot about a difference and making a difference. But we are all clear on that. We all know that. Civilization has, from its inception, nature, we have fought nature. We fight against nature as if we could, but we forget that we are part of nature. So the first thing for anyone is for people to understand that life starts in the water, in a single cell being that expands until it becomes as complex as us human beings. We are all water, we are all earth, we are rain, nature, chemicals. There is no distinction between nature and myself. I don't have to take care of nature and protect nature. I have to take care of myself because I am nature. This anthropocentric understanding is crazy because it gives me the feeling that if I'm successful within my bubble, that would be great. But the bubble is petty, small. Giselle Bündchen within the bubble is one of the most famous women, and she talks about depression and suffering. So if you have everything that civilization has to offer you, you would come to be a Giselle Bündchen to say that you don't want to live. You are going to be a young people that wants to kill themselves. So life could give us more. The relationship with nature, with life, with others, recovering our existence. Existing is living within the body that I have now, but also with the virtual aspects of us, my thoughts, my concepts. I want to think about the world when I take a step on the earth. Every time you take a step, you're leaving a footprint. And so, change is individual. The choices for you for the next year are going to lead to self-knowledge, and I'm sure about that. It's no use of, sending your kids to university if they are going to kill themselves. Do you have any idea the number of successful young people that take their own lives? So you have to be bold. You have to be courageous and committed. You need to look at your children, at yourself. If we all understand that we are small and fragile, we are going to create around us a network of goodness. So when the next pandemics come, we'll have a system of protecting one another and not competing with our neighbor with our cars and our clothes and our picket fences. So what we need to bring to humanity now is the principle of frailty. Anything could happen at any moment, at any time. We need each other. We need to be modest and humble. Change is individual, and that's what we have to think about. And Vivi, this idea that you're dissociated from the environment is responsible for this chaos that we are living through now, right? Yes. So, Dr. Drauzio, now we have the vaccine. We need to dedicate ourselves every day to explain its benefits and the need for people to be vaccinated. Can you give us examples of what the vaccines have done for humanity in the 20th century? We started the 20th century in the 1900s with a life expectancy in European countries, developed countries, around 40 years of age. That's how long a person lived, 40 years old. And what made the difference to today, in European countries, the life expectancy is 80 years old. And here in Brazil, our life expectancy is 76 years old. We had until the pandemics, of course, with the number of the dead, it's going to fall. But what happened in the 20th century to cause this doubling of the life expectancy? What could have happened? Well, let's recall that if in the 1900s the expectancy was around 40, in the Roman Empire it was 30 years old. Well, we say that Christ died young at 33. Well, no, he died around the age that people died. During the Roman Empire, life expectancy didn't change much. What changed everything was the way we eat, the possibility of getting food, basic sanitation, the pasteurizing of milk, a number of factors, but the most decisive factor were the vaccines. Children used to die. I remember I was a medical school student and we did anamnesis on our patients, and they asked us to ask those ladies how many children they had, 7, 8, 10. The rate of birth was really high. And the second question was, how many did you raise? Because children dying was normal, something accepted by society. Vaccination made a difference. Vaccination is going to control these epidemics. This idea of herd immunity is, something that is so ignorant. No viral disease has ever been controlled by herd immunity. Chickenpox, the pox, poliomyelitis, and other diseases, they were around for such a long time because there is no such a thing as herd immunity without vaccination. So let's enjoy this high efficiency vaccines in record time and let's get vaccinated. Dr. Drauzio Varella and Viviane Mosè, what a pleasure to have you here at the closing of our event. Thank you so much for your participation with such great talks that are very assertive, but at the time so welcoming, cozy, and warm. Now that so many people are undergoing so much loss, you bring us hope, but always objectively warning people to study the course, to think about a fairer future with self-knowledge, with self-care. I wish you all the best, and I see you at the next opportunity. Thank you. That was it, guys. It was a great conversation. So now we are going to hear from the Industrial Technology Director from Klabin, Francisco Rasolini. Rasolini, how are you doing? What a wonderful thing to have you back here. How are you doing, Rosanna? Good afternoon to all my colleagues here at Klabin and also our guests in this festival. This intensive journey we had this week, this is just the beginning of it. We have this continuity of the Inova Klabin festival. We had a lot of talks and a lot of presentations that were very interesting. that gave us great views and a lot of ideas and insights in many different segments. It was wonderful what happened here. We were able to follow part of it, and I confess that I wasn't able to follow everything, but I have a lot of things to watch this weekend and the next following weeks. Many interesting, instigating, inspiring ideas, examples, and challenges for us to follow in this innovation process. And we shouldn't be thinking about innovation just as disruptive innovation or something that is um, totally unique. We have to think about process. We don't need to be Einstein or a specialist or an expert. We need to create a process within us and within the organization for this knowledge to permeate, this instigating, this constant challenging, for it to keep happening, to allow us to seek solutions that are going to make the company more competitive, our products more competitive, our universe more competitive. And that is valid to for all the areas, not only technology areas or production areas. This process needs to happen, and all areas of the company becoming a way of thinking and of reflecting and of acting. This is a process that I believe, is going to support our teams in a great way. I believe that we have reported when we started here on Monday that this journey is growing, is ever growing, and we have had major support from all Klabin leaders, and it will certainly put us at greater levels and more interesting levels every day. So this is my thanks to all the team who has worked with us for this Inova Clubbing event to happen, all the teams who worked and all of you who have participated. We had a wonderful number of people participating in virtually all of our broadcasts. So enjoy the content for the next few weeks. Enjoy the opportunity to watch this material, to review some of the material that's more interesting to you. Talk to your colleagues, make that known. This digital journey here, this happening, this remote festival that we had allows us to include many people. We are going to continue with our new Klabin motto, transformation with a purpose, or innovation with a purpose, trying to make a better world. Thank you, everyone. Thank you, Rosanna, that you provided to us this week. Also carrying out the main interviews and doing our start and end events. So I wish you all a great weekend. Thank you, and as Dr. Drauzio Varella just said, keep protecting yourselves, keep using your mask, keep, self-isolating, use hand sanitizer, preferably the one manufactured here at Klabin, which is really good. And we'll keep on working for everyone to get vaccinated. Vaccination is coming faster, so I hope that we can then start having hybrid events with this remote access and in-person access, bringing together the entire company in the renewing of this purpose in this continuous movement that has been driving us and the company. Thank you and have a great weekend. Rosalini, thank you so much for the opportunity of presenting and moderating the interviews. It was a great learning, and this step is a great one to review all the content that was produced. Wonderful interviews, great curatorship. Thank you, Rosalini. And before I give it to Cristiano Teixeira, our general director here at Klabin, I would like to thank so much for the invitation to present this event with such relevant topics for the development of business and our society. It was an honor. It was a great pleasure to be here mediating the interviews and giving you tips. It was a lot of learnings for me. Reminding you that all these presentations are available in our platform until the end of the month of July. So you can still watch it. So I say goodbye, wishing you great health. Please take care of yourself. And for sure, we are going to overcome these very hard times for all of us and for the planet. So let's close listening from Cristiano Teixeira, Klabin's General Director. Thank you, Rosanna. Thank you, everyone, for the participation. It was a wonderful, extraordinary event that made us think, that made of all of us more curious human beings. I believe that we need to ensure that this event is going to turn us all into more curious people. I like what Chico said, that we don't need to be Einstein. We have this Klabin attitude that we talk about. I think this innovation attitude is keeping this provocative look. I am very proud. It is a pleasure to be a part of this team. We here would like to say a special hello and give our thanks to these wonderful CEOs and other people who participated, who gave us different views aligned with the context of our planet. And perhaps I would like to highlight very directly the way that I am with you. Don't be fools. Please don't pick which kind of vaccine you're going to take, what brand of vaccine you're going to take. Don't think about not vaccinating yourselves. Don't allow yourselves to think about something like that. We have the commitment to each other here at Klabin. We have been going through a very tough year, a year that has been hurting us, where we don't sleep, where we feel the losses that we have suffered here in Klabin and throughout Brazil. So for all of us, on behalf of our community of over 25,000 people, don't allow yourselves to be foolish. Get vaccinated. Don't, don't pick what kind of vaccine you're going to take. Help the people next to you. I'm sorry for being so direct, but you know how I deal with this kind of topic. Thank all of you. Thank you, all of you. It was a wonderful emotion to be part of this event. Thank you. Bye-bye.